Hello, everyone, and welcome to our new Quick Talk series, Quick Answers to Trending Topics. Today's very important topic is on water safety. I am Allison Circo, the Regional Director of Community Outreach with Hackensack Meridian Health and Hackensack Meridian Health's Children's Health, and I will be your moderator. We're very grateful to have with us Mackenzie Murphy and Patty Bonatakis from our pediatric injury prevention teams from Hackensack Meridian's Children's Health speaking with us today. The information presented and discussed today is educational in nature and is not intended to be taken as a specific recommendation. If you have any personal questions or concerns, you should speak with your primary care physician. All right, so we will get started. Today's first parent question is, are floaties safe?
That's a really great question, Allison. I think a lot of parents purchase these floaties for their kids, thinking that it's keeping them safe in the water. But there are some caveats to that. The thing with floaties and water wings, things like that, they keep kids upright in the water. And this is not natural for how a child learns to swim. Part of the problem is that a lot of times this prevents them from getting their face in the water. So when their face is in the water, they get a little nervous and scared. Another thing is that causes a muscle memory for the child. So they're really going to not have that natural inclination when they're learning how to swim. Another thing is that it gives a false sense of security, and that's on both ends. Kids have these products on and they think that they know how to swim. And that, obviously can be a problem. On the other hand, too, it also gives parents a false sense of security. They feel that if the child has these devices on, that it's safe in the water. And sometimes they tend to be not as vigilant about watching the child, and kids don't understand that it's that device that's keeping them upright in the water and not them doing it themselves, and besides the fact too, they can slip off, the ones on your arms can deflate, and then the child really is in trouble.
Exactly. And then the neck rings also have an increased risk of drowning, suffocation, neck strain, or neck injury. So it's
Definitely.
really, yeah.
I think people use those a little more often in the home, maybe in the bathtub or something with very small children, but they are definitely not recommended.
All right, our next question is, who is responsible for watching kids at the beach?
So this is a great question because a lot of times when people think of the beach, they think they have a babysitter, as in the lifeguards that are watching the children at the beach. But in reality, lifeguards are there for emergencies and not for supervising young children or new swimmers at the beach. A great idea to kind of get around this is to assign a water watcher. So as you could see in the photo here, a water watcher, it's a card here that could be printed for free online, and it could be given to a designated parent. It's important that the parent is sober, attentive to the water, and is able to swim in case they need to help the young children in the ocean. The water watcher card is great because just say mom is the water watcher for the first 15 minutes. It is her responsibility to be looking out at the ocean, watching the kids, making sure they're all safe. And then if she needs a break, if she has to use the bathroom, or maybe she wants to take a dip in the ocean, she gives the water watcher card to another parent who is then responsible. This ensures that everyone is accounted for when in the water, and you're not just assuming that, oh, someone else is here, someone else is watching my kids. It kind of gives that responsibility to that parent to be watching the children at that time.
Patty, you mentioned about 15 minutes, right? And I think that 15 minutes is a great length of time because it's really hard to concentrate only on one thing, for a longer period of time with not having any kind of other distraction. So I think longer than 15 minutes, sometimes your mind starts to wander and you're not as focused on the task.
Exactly. And it's important to not be on your phone, texting, calling. Your job is just to be watching the water during those 15 minutes.
Great. The next question is it safe for my kids to bury themselves in the sand?
Oh, this is great. I think everybody has done that where you bury somebody in the sand. Maybe you're only burying your legs or something like that. But you see in this picture, this guy, he's buried all the way up to his neck. And this is actually really dangerous. They say not to bury anybody deeper than the knees of the shortest person in the group, or this is a big risk for suffocation, and in a couple ways. First of all, when you think about dry sand, it's very it's grainy, it kind of flows. If you pour it, it just flows evenly. The problem is that that will flow around you when you're buried in the sand. And the big problem is that that puts pressure on your body. Pressure on your chest, makes it very hard for your lungs to expand. Your chest can't expand, and you basically are suffocating because you cannot ventilate properly. And if you get buried in the sand, like if your head gets under the sand, you can even inhale the sand. And that obviously is really dangerous as well. Wet sand is not as horrible, obviously, as dry sand, but it's very heavy. About 130 pounds per cubic foot. So that's like equivalent of having 20 pounds of bricks on your chest. So you can imagine if you had 20 pounds of bricks on your chest, how well are you going to be able to breathe?
Yeah,
right?
exactly. And you
Not
could
very
also
well
get,
at all.
yeah. I just wanted to add in, you could also get injury from any of these unfilled holes. So you may be walking along the beach and not even notice the hole and fall in. You could end up with a sprain or a fracture. The beach vehicles as well that are driving along could drive right into the holes, depending how big they are. So
Right. And this is so dangerous that now several of the beach towns like Seagirt, Belmar, Seaside Heights, they've actually made limits on how deep the holes can be to help keep people safe.
All right, thank you. The next question, what do I do if I'm stuck in a riptide?
So riptides are tricky because they come pretty quickly and there's really no warning sign that a riptide is coming. One thing to keep in mind is that you should not swim against the current. You should try to get out of it. So instead of trying to swim back and forth aligned with the current, you should try to get out to the sides of it, parallel to the shore. This can be tricky for a new swimmer or someone that's out there alone and may not know that they're in a riptide right away. That's especially important to not let new swimmers go out into the ocean by themselves. They should be with the parent or an experienced swimmer to help them. You should try to remain calm and try to stay afloat while also signaling to the lifeguards at the same time. Most times the lifeguards will know this is happening and come get you, but it is important that you could float and stay above the water because it may be a few minutes before someone could come to help you.
I like how you said about remaining calm, because I think the impulse is going to be to panic.
Definitely.
Panicking is not good. You want to make sure your kids know if they do get caught, stay as calm as they can, because that panic is going to use up energy and make it harder for them to stay afloat till the help gets there.
Definitely. And then it's also important to only swim when the lifeguard is there. So typically beaches are 9 to 5, 7 days a week in the summer between Memorial Day and Labor Day. So if you're there at 6 o'clock at night and there's no lifeguard and you were to get caught in a rip current, you really are relying on strangers that might be at the beach to come and help you. So it's even more dangerous and more important to only swim when there's a lifeguard on duty.
Absolutely.
All right, the next question is, what bathing suits help kids be seen better?
Oh, that's a great question. So, Patty said a couple times now about the lifeguards, right? Make sure the lifeguard is there and everything. Well, you want to make sure the lifeguard can see you, right? So this has gotten a little bit of attention lately with the bathing suit colors. Bright neon colors are going to make it easier for the lifeguards to see you in the water and on the beach, right? Neon colors, you can see if the water is bright and light, or if it's darker water condition. If you're in a pool, having contrast of the colors makes it a little bit easier. Blue, which we see a lot of blue swimsuits out there, but that can really camouflage your child in the water. White, you'd think, well, white is a nice bright color, that would be a great idea to put on. However, when you're on the water, sometimes if it's a nice day, the clouds are reflecting onto the water, and it can kind of be deceiving whether that white is a bathing suit and a person, or if it's a cloud just reflecting on the water. And then when you're in the ocean and the lake, those darker colors are harder to see. The bottom of those surfaces are darker, makes it harder in the darker colors. Yeah. Another thing you can do are those neon rash guards. They're nice and they're bright, and they have an added benefit of protecting you from the sun, which we can be very harsh in the summertime here.
Yeah. Definitely. And this is all great knowledge that I feel like is not publicly known. So it's great to share with parents.
Definitely.
Thank you. The next question. So how do I make sure my kids can't get in the pool alone?
So this is a great question, because a lot of times we just assume that the door is shut or that the windows are shut and our kids can't get into the pool outside. But kids are smarter than we think, and they will find a way to get outside and get what they want. In New Jersey, it is a law to have a fully enclosed barrier around your pool. This must be at least 4 feet tall, and it could be a fence or a wall. So if it's a fence, it could be 3 sides of a fence, and then the fourth side is the house, so the wall of the house. It is important, though, to make sure that when you're done swimming or done for the day, that all the floats and toys come out of the pool area. Because a lot of times, just say your kids are outside around the pool, they might see that toy that they want that's floating in the pool. And they will try their best using their siblings or their friends to get over that fence and get that toy. So that's just one little distraction that could, make a serious problem. So another thing for young kids is inside the home. We have to be especially careful with the bathtubs and the toilets. A young child, anyone under 2 years old, could drown in a toilet by going headfirst into it. So if we shut the toilets when we're done and then we shut the bathroom doors so that the children cannot get into the bathroom, that's really a smart practice that we should just be doing all the time. Whenever baths are done, we should drain and empty the bathtub right away. And this also goes for buckets outside, a large bucket or a swimming pool for little kids or for dogs. We should just empty them once we're done.
Right. You said about with the toddlers and falling in the toilets and the buckets. You think about the body of a toddler, right? Toddlers have kind of big heads in relation to the rest of their body. If they go head first into one of these buckets or toilets, they can't lift their heads out, So this is a really dangerous situation that I don't think gets a lot of attention.
Yeah.
All right. And our final question, what is the best thing I can do to prevent drowning?
So the best thing that you could do is to get your kids swim lessons. Unless you are an experienced swimmer or a lifeguard, swim lessons are really essential to teach your kids the proper ways to swim. It's great to start at a young age because, like we just mentioned with toddlers, kids are exposed to water from the day that they're born. So it's best to start at a young age. Kids are surrounded by water. Like we said, even if you don't have a pool at home and you are only going to the beach, you have that bathtub at home, you have that toilet. So it's best to start early. Drowning can be prevented if your child knows how to swim. It's essential that your child could jump into the water and have water above their head, that they could float for at least 1 minute, that they could swim to the ladder or the stairs. It's also important for a public pool or a community pool that your kid knows how to get out of the pool without using the ladder. These are just some little tips, which would all be reviewed when your child is in swim lessons.
All right, that's great. So, we just want everyone to know Hackensack has pediatric emergency rooms at our K. Hovnanian Children's Hospital in Neptune and the Joseph Sanzari Children's Hospital in Hackensack. Pediatric emergency rooms open 24 hours a day, 7 days a week. If you have any needs, please seek out care here. Thank you so much for listening.
Yeah, thank you so much and have a great summer.
Thank you so much, Patty and Mackenzie, for sharing this very helpful, important information. And I hope you will all be on the lookout for our next quick talk. Take care and have a safe summer.
Thank you.
Bye, everyone.
Bye-bye.